is in second year and fourth year, and GN first year and third year. So I would like to continue some more topics. In this class, I would like to take disinfection. This is a very important question, and this topic is existing even in microbiology subject also. So this is all, in any area you can use this content. So disinfection. In previous classes we have discussed like infection is there, infectious agent is there, some microorganism is there, it is spreading from one person to another person. That is what we are saying. That means either direct route or indirect route, some agent is moving from one person to another person and causing the disease. And during COVID time, what we have done? We have done some of the tasks like we used certain measures to control the infection, in some stages of life. So that is what today I am going to. So removal of microorganism. Infection means it always comes through biological agents. So when you remove that causative agent or the infectious causing biological agent, when you are trying to remove, that is called disinfection. Now, as you all know that during COVID time, as general measures what we have done is like to kill the microorganism in a throat or in ear, nose. What we have done, we have taken a heat stick, so that with that heat the microorganism will die. Or sometimes after washing a cough or sputum, kerchiefs, everything, we put it dry it in the sunlight. That is also one method of disinfection. There are different methods are there for disinfection. So in this class I am going to give you a brief explanation about the disinfection. So in the disinfection, if you see the classification, there are three methods are there. Please have a look. There are three methods are there. So first one is the natural one. What methods we are using to destroy the microorganism? The first one is natural one. The word itself is saying natural. Here we are not using any other substances or chemicals or phenol or acid or lysol, anything we are not using. Whatever comes as natural things, that things we are using usually is at home. So best the things, natural examples, there are two types are there, like air or sunlight. Air or sunlight. So air, everybody knows. Suppose if we pass through some heat air, some like vessels or anything, we are passing through the heat air, what will happen? The microorganisms which are existing in the dishes or anything, it will be automatically destroyed. That's called air. And sunlight, everybody knows. Usually we will keep all the equipment or formats or the utensils what we are using for the infectious person. If you keep under the sunlight, then automatically the microorganisms will be dying. These two are called as a natural methods. And the second type we call it as physical methods. The second method we call it as physical methods. Please have a look of this class very clearly. It is even useful for microbiology, and the same topic is existing even in the nursing foundation also. Okay, so but in detail everything I am not giving, but it's a brief explanation is enough you to elaborate your content. So physical things which what we are using to destroy the microorganism. In this, since olden days we have some methods, like suppose if you want to use it like what we can say, dry heat. We want to cook or we want to make some pickles. What we will do first, that vessel will be clean and we kept on the hot flame, so that what will happen, if any microorganisms are there in the dish, it will be automatically destroys. So that's called it as a physical methods. Here we are not using any chemicals, but physical methods we are using. In that, the first method we call it as a dry heat. We call it as a dry heat. So that dry heat can be by burning. Dry heat by using two methods, by burning, or second method is hot dry. Hot dry air. And I think everybody knows physical method what we have used after COVID patient has died. We have taken all the things because we don't want to reuse it. So we will burn it. If we burn it, automatically disinfection, completely the microorganisms completely vanished. So this is the method we call it as a burning or hot dry air. Hot dry air means already I said that especially during COVID time, when we pass through some areas, we can feel like hot, so that it is causing destroying of microorganisms. So that is the one method we can say. It is under physical methods. Under physical method of disinfection, first method is called it as a dry heat, and second method is called it as a moist heat. Second method is called it as a moist heat. The word itself is saying moist, means with some using of some water, some wetness will be there. So some wetness will be there. Everybody have used during COVID time boiling the water, keeping all their vessels who are suffering with the COVID. We will keep all the equipment in that hot water and we will take out. So that is what even I have done for during my mother got COVID positive. The same thing I have done. So every day I used to, some things we have thrown out, and some utensils, especially what the plate or glasses, whatever she is using, every day I used to clean with hot water. After cleaning everything again, the plates I used to keep in a boiling water for 5 to 10 minutes. Then I will take out. Again I will do dry heat also. I will keep it in the sunlight. So that I can reduce the infection presence, and I am trying to destroy the microorganisms. So that's called moist heat. Best example is boiling. Everybody knows. Let's call it as a boiling, the first method, and the second method is called it as a pasteurization. This is a very worldwide technique since long time, where Louis Pasteur has invented this pasteurization, and this method is used by all dairy farms. That is how the milk is pasteurized. They pass through certain processes, and in that process the microorganisms, suppose if any microorganisms are coming through vector borne or vehicle borne, or maybe because of animal borne, some anthrax like that, so they want to kill it, they cannot boil and distribute it back. So that's where they use pasteurization. This is another method. It is also used by wet organic. That's why we are discussing under moist. So it also comes under physical method. In this also we are not adding any chemicals. Okay. And the third method we call it as radiation. Radiation means this is a method usually we use in all hospitals after operation theatre. If they want to wash any scissors or clothes or any materials or operation equipment, anything they want to disinfect, so they use this method, radiation method. So the radiation method can be used by some gases or formaldehydes, by using of some gases or formaldehydes. Formaldehyde, this is a radiation where the high temperature will be exposed to the infectious material, and with that it will be cleaned completely. So this is called radiation. So under physical there are three methods are there: dry heat, moist heat and radiation. Under dry heat means by burning it or hot dry air using, we can kill the microorganism. Moist heat means it can be by boiling or pasteurization, and by radiation means by gases or formaldehyde. These two are we can see clearly in operation theatres, especially daily before doing starting of any surgeries. Usually we use these gases to disinfect it of total operation theatre, that if any microorganisms or anything is existing in a table or in articles or in equipment or anything which we are contacting with the patient, everything we disinfected by using of radiation method only. Okay, so this is about physical methods, and the third method is called as a chemical method. Third method we call it as a chemical method, and this chemical method, if you see, I think you can able to see now. So chemical methods means in this method definitely we have to use some chemicals to kill the microorganism, and everybody know that a best example Dettol is the simple chemical which can kill the microorganism. If you add in a tub of water, and it will be automatically can kill the microorganism. So that is what. So in this examples I want to give you chemicals. So first one is liquids. Everybody knows so many liquids are available in the market, like phenol, Lysol, all things comes as a disinfectant. That's all comes in the liquid form. Examples: phenol, Lysol, and formalin, chlorine. Phenyl, Lysol, chlorine. This all comes under liquids. And second form is solid form. Solid form. It's an example, we call it as a lime or bleaching powder. Everybody knows lime or bleaching powder we are using as disinfectants for the water. So that comes in the solid, like in a stone formation, or it can be in a hard formation. It is comes. That's why we give an example of solid. So examples are lime or chlorine. Chlorine, I think everybody have seen. It's like a white one, like a powder form it comes. It is not in the liquid form, it is in a solid form. So the third one is call it as, so that there are different types of examples are there, like fluorohexidine, and this all things will be comes as a chemicals only. Whatever agents you are buying from the market to disinfect your washrooms and your floor, everything comes as a liquid chemical disinfectants. Liquid chemical disinfectants. So these are the different types of disinfection methods we are using in present situations in different areas to kill the microorganism. Alright, so this topic has completed, and I just want to give you when we have to do this disinfection. When we have to do disinfection. Already I gave example, daily I used to clean my mother plate, everything when she got a COVID. So that is a one method that immediately I am doing. Let's call it as a concurrent disinfection. Suppose a TB patient is there, I want to throw the sputum, I want to throw his kerchiefs, everything. That can be daily I am doing. And in hospitals daily they will discard certain types of materials day to day life. That is called concurrent disinfection. Means when patient is inside the hospital, when person is still existing with infections, in day-to-day life to prevent the transmission, whatever activity you do, that's called it as a concurrent disinfection. In present, you are doing the disinfection, that is called concurrent disinfection. And second type is called it as a terminal disinfection. Terminal disinfection, the word itself is saying after the complete patient recovered from that infection, and whatever you are doing, like throwing all his equipment, whatever is used, or whatever equipment is used by the patient, burn it off, or throwing, or maybe completely cleaning. Means at the end, if you do, that is called a terminal disinfectant. And the third type is called it as a pre-current. Pre-current means, is everybody knows that before reaching to the patient, from one patient to another patient, we will go and do the hand washing. That is called pre-current. Means before occurrence of any presence of any diseases also, we take some measures. That is called it as a pre-current disinfection. So this is a different three types of disinfection processes usually we will follow. First one is concurrent, and day to day life whatever you are doing to prevent the transmission of infection, that is called concurrent disinfection. Terminal disinfection means at the end of recovery of the patient or death of the patient. Anything can happen. It's complete recovery of the patient or death of the patient. When you remove completely, let's call it as a terminal disinfection. And the third one is pre-current. Pre-current means before occurrence of the disease itself, whatever measures you are taking to prevent the transmission, that is called pre-current disinfections, that is hand washing. So if you really like my class, please do subscribe and share, because I am spending a lot of my personal time to share my knowledge to somebody who is in need. If you really like my classes, please make one like and share and let somebody get benefited from my video. Thank you. Have a nice day.